Lulefa, is my name. I'm the senior hospital pharmacist.
Good afternoon, honorable members. Good afternoon, the accounting officer and the team from Kiruddu National Referral Hospital. We are here as the Public Accounts Committee of Parliament, basically on accountability. Accountability for occupants of office and accountability for the funds you received for the financial year 2024-25. Aware of your mandate of providing high-quality specialized clinical care, education, training, and research to the public. We know you also function as a tertiary facility specializing in dialysis, burns, and infectious diseases. You aim, as the hospital, you aim at provision of accessible patient services at a cost-effective and also strengthening a national referral system. Aware of your mandate, the aim is to improve healthcare access and efficiency with the mission that includes fostering a serve approach, that is service, enthusiasm, respect, and value and excellence. So aware that it is the mandate of government to provide basic health services to the people, Kiruddu National Referral Hospital received, he was allocated funds the financial year 2024-25, and you are here to account for the money that you received. However, before you proceed, we want you to update us about the bed capacity. You also update us on the last time you left this place, you had issues of space. You need to update us whether this time round you expanded, and also the doctor to patient ratio and the nurse to patient ratio. Accounting officer, some 5 minutes to take us through what Kiruddu does and respond to those questions that have been raised.
Thank you, Chair, and honorable members. Good afternoon once again. I bring you greetings from Kiruddu National Referral Hospital. Our vote number is 417. Chair, I had you had 413. Our vote is 417. Kiruddu National Referral Hospital started in 2019 when it became a vote, breaking away from Lago Hospital where we were. Our bed capacity is 200 bed capacity, but occasionally we go to occupancy goes to, we get about 250 patients in the unit. What is our staffing? Our approved structure, which has expired now, which is due for renewal. The old structure was populated up to about 30% only. The update I want to give you is that through various engagements and through your intervention, this financial year we've been given an additional 3.5 billion. Next financial year, sorry. We've been allocated 2.7 billion, which we think, if we get guidance from Ministry of Finance, we should be able to improve our staffing capacity maybe up to about 40%. Chair, regarding the land, yes, as members you remember, Kiruddu is located in a place where it was a health center for. So the space that we have is very constrained, and this has affected our capacity to expand and also greatly constrained our capacity to improve quality of service that we think we should be aiming at. But I'm glad to announce that we are in advanced talks to acquire another small piece of land behind the hospital, which is under half an acre. We had allocated funds for it. In fact, by now we would have procured it, but we're still getting a few challenges because the squatters on the land had issues with KCCA. So they feel that that should be first sorted before they sell the land to us. So that is the only limiting factor we have right now. Otherwise, we have the funds. The funds have been availed this financial year, and if all goes well, we should hopefully complete the procurement before the end of the year. Chair, I think that addresses the main issues that you requested me to
You are
comment.
not clear on the staffing. You want to know the number of staff that you have versus the structure that is approved, the running structure.
The staffing we have as of now, like I said, the structure that is approved is 830, about 840 that is approved. But this has only been populated up to about 30%. So we have about 280, 290, as of now we have 290 staff that are active. So which constitutes about 30% of the approved structure.
What is your patient to doctor ratio?
That varies based if I include the interns and maybe some volunteers that are there. But when I look at those that are on the structure, I need to compute that. I'll maybe request my team here to compute the figure and we see. Otherwise, on a daily basis, we see more than 500 patients in the hospital on a daily basis. But if we look at the doctors that are available on the structure versus the numbers, definitely the numbers are still low. I'm going to compute that number.
What's your target population?
Being a national referral hospital, we look at the whole nation. So it's a national. So we look at the whole of Uganda, which is.
No, but as you do the planning and budgeting, you have a targeted number of, a targeted population to serve. Is it open-ended?
As a national referral hospital?
As a national referral. So for you, you don't have a space. Say we intend to serve a population of 3 million people. Is it open?
We plan, we set targets and say admission, we tend to have 20,000 patients admitted annually.
That's what we mean.
Yes. Inpatient, we have 20,000. Outpatient, what is the number? Let me confirm our numbers on the outpatient, but inpatient usually 20,000 patients admitted. That is our target for the year.
Okay. Honorable colleagues, let's go to, yes, Honorable Angura.
Yes, Madam Chair, I want to find out from the accounting officer. Kiruddu had been having a recurrent problem of drainage, sewage challenges that have been recurrent and inconveniencing you because of the size of the land and the corridor. How far have you gone about with that, and is it history now, or you're still challenged with the similar situations?
Yes, Honorable Mudimi.
In addition to what the Honorable Angula has said, much as the space is not adequate, but we are told you don't have land title for that facility. As of yesterday, the hospital where it is, they have no land title. Is it true? Or?
And as you plan to getting a bigger space, I remember during the presidential tour of the parish development model in Kampala, this was 20th July 2025, the president made a pronouncement that Kiruddu should be reverted, Kiruddu and Kawempe should be reverted to district hospital status than national referral hospital. What is the progress?
Thank you, Chair. I'll start with the first one regarding the issue of drainage. Honorable members, I would like to announce that the issue of drainage is in the past. Government in the financial year 2023-2024 gave us a budget of 500 million, which we passed over to National Water, and National Water constructed a treatment plant, which is now functional. So the issue of drainage of sewage in the hospital is in the past. So we no longer have that challenge anymore. It's an off-site, it's not in the hospital itself, it is down in the valley. That is where all the water and effluent from the hospital is eventually sent. So we're glad that that is not a problem for us anymore. And we're grateful to really intervention of Parliament. The issue of the land title, you're very right. Chair, like I discussed even last financial year, KCC was the user of that hospital. They owned the land title. We have had numerous engagements for them to transfer the title to Kiruddu, but they have never effected that. And this has, I think, been brought about that every time we are in advanced talks with a certain administration and KCCA, unfortunately there's a change. So there have been numerous changes in the top leadership at KCCA. So every time a new team comes through, we have to restart the process. Right now, we are planning a meeting between the lawyer of KCCA and the Solicitor General so that we have this finally resolved. So indeed, it's true, we don't have the title, even where we solicited for funds to construct a sewage plant. That because this procurement was done through KCCA, that land was still registered under KCCA.
But Doctor, do you know the risk of not having a title? KCC can allocate to another person. What are you going to do? You've seen schools here, public are removed if they allocate to another person.
Yes, Honorable Minister, Honorable Member.
I am not a minister, but what
Honorable Member, definitely we are very aware
You
of that
might
risk.
become.
Yeah.
We
Such
have
that I fix that problem.
Through you, Chair, very true. We definitely have a challenge, and we know the risks. And unfortunately, it has even hampered our own progress, because many times when you want to construct something, like recently I wanted to construct a maintenance store where we can maintain our equipment. We had to go to KCC to get approval for the plan. And you know, they rejected our plan because they said, you don't have ownership of this land. So that definitely stalled our progress.
Chair.
Tremendously.
Yes, Honorable.
What was the agreed position when you took over as a referral hospital? Did you have any understanding with them in regards to the land issues and the ownership of that place? Because if you don't have clear written agreements, then there's no way you are going to begin developing something on something that you have not fully taken over.
Thank you, Honorable. Chair, we know that the Kiruddu story has progressed with time. We went to Kiruddu initially as an interim arrangement when Mulago was undergoing renovation. When we moved in there, Cabinet pronounced itself and said Kiruddu should become now a separate entity. And the minute is there that created Kiruddu Hospital as a separate entity from KCCA. And unfortunately, we have tried from that time when we were created to have some independence. We have moved in many other areas. Unfortunately, the area of handing over the titles has not been very easy. And we're not alone into this. And we know Kawempe is in the same boat, Naguru Hospital is in the same boat. They all don't have these titles because these were initially KCCA hospitals.
Honorable colleagues, let us proceed. Though you said that your bed capacity is 200 and you have 250. This means you no longer have.
You raised an important question about the president's either comment or an informed position to downgrade Kiruddu back to a district hospital. Are you aware of that?
Yes, thank you, Honorable. Yes, this was a pronouncement during campaigns, and we waited for an official communication to get to us. We have consulted the Minister of Health to guide us on how we should plan our new structure, whether we should plan now based on the fact that we are going to be downgraded or to be maintained as a national referral hospital. Verbally, we've been told that we are going to maintain the same course like we are right now, but there's no written communication to that effect. Yes, they've told us to keep the course.
So for now, you are a national referral hospital. What do you think prompted the president to make such a pronouncement? Could be by the virtue of the services that you give, you are meant to be a district hospital. Why could we, reduce the status to a district hospital, yet you are equipped as a national referral hospital?
Briefly, Chair, I know where that came from because even before that pronouncement was made, I was in contact with the chairman of the NRM of the area, They were very happy that the area, Machinda Division, had got such a big hospital. But when we were being created, Ministry of Health agreed that maternity and pediatrics is going to be in Kawempe. Kiruddu is going to be internal medicine and plastic surgery. So when the community noticed that, when they were constructing the hospital, initially they were excited thinking that they were going to get a complete hospital within their community. Now you are telling them that no, for us we don't handle maternity. So that angered the community a bit. So when the meeting was in Kawempe, when they were meeting the president in Kawempe, it came up. So they raised the issue, said, yes, thank you for giving us this hospital. It is assisting us, it is doing all this. But our women are not delivering there. And that was the origin. So the origin was not the scope of services. It was like more of, we want it expanded to offer more. But the truth is, it's difficult for you to divide a 200-bed capacity hospital in Kampala and provide everything. Otherwise, you're going to have 3-4 beds per specialty, which doesn't make sense.
But you know, previously we used to get reports that Kiruddu is very congested. When you say that you have a bed capacity of 200 and you can accommodate 250, that means for you, when it comes to congestion, that is no longer a challenge.
It is not, Honorable Chair, it's not like it's not a challenge. It's not a challenge that we create. But I want us to look at it from the perspective that we are a public facility. So when a patient comes to you, you are first supposed to stabilize that patient before you do anything. Because what has happened, because of the policy changes and the economic environment, we have noticed that many patients are being referred from Zambia, from Rubaga, and other places, and are being referred to us, and we're a public facility. So initially we stabilize, and if we think we cannot accommodate for longer periods, we refer these patients eventually to Mulago. But sometimes Mulago also gets full. So then there's no other place to refer many of these patients, other than you creating a bed and see how to treat them.
No, that's why I asked that from the 200-bed capacity, what is your occupancy rate? You say 250. This means congestion is no longer a challenge. That's why I want you to commit yourself that with the Kiruddu now, there is no congestion. You are, because 50 excess is affordable.
Chair, I want to announce that that bed hospital initially was constructed for 170 beds, but officially it was allowed to go to 200. So when you go to 250, you are definitely pushing it to the limit.
Because you know we had a challenge of your colleagues who are here in the morning, Butabika. It has a bed capacity of 550, but they have 1,200.
Yeah.
At least for them, you see an outright call for expansion. But for you, was 200 bed capacity and the excess is 50. Comparing the financial constraints in different sectors, you can keep there for a while. That is, to you, you are fair okay compared to your colleagues. So, honorable colleagues, for Kiruddu National Referral Hospital, congestion is no longer a challenge. But once we happen to get to that place and we find that people sleeping in tents out there, no, the account officer has said, now Kiruddu is very okay. You cannot find women sleeping in the tents out there. That is the impression you are giving. Once we get there and we find the people outside, you will be held accountable for giving false information to this committee. No, he said...
The women are referred to Kawempe. When we are full, we refer the patients to...
No, for us, we are talking about your occupancy.
Our occupancy...
For now, you are very okay.
No, let me restate it, Chair. Our bed capacity is 200. But we sometimes hit the 250 mark, or even 270. That does not mean that we don't need more space. And that is the very reason why we are in advanced talks to acquire more land so that we can expand. But I am also putting it in, which one? The 250?
So what are you adding on? You don't have, then you are.
Chair, we have done all efforts and have provided to this committee a lot of evidence on our discussions regarding transfer of the land. And we have a whole file of engagements that we've had with KCCA regarding transfer of the land. And some of the communications I've already submitted to the committee here in our previous engagements. I can always provide more of that. We recently wrote to lands, and they even gave us clearance to have talks with the neighbors so that we can expand the space on the space that we have.
Honorable members, we are going to start direct with the mandate of Kiruddu National Referral Hospital. We are just going to take note of the budget that we receive. However, we are just going to go direct to the review of dialysis treatment in Kiruddu, because that is your basic mandate. Honorable colleagues, we take note that Kiruddu National Referral Hospital received a budget of 28,629,523,099. 3.5 performance of GOU warrants. You received that money. No, you had a shortfall of 569 billion. We take note of that shortfall. So you got a performance of 98%. So we got performance of non-tax revenue. The auditor reviewed the approved budget for non-tax. You planned to collect 650, you collected 972. Over performance of 150%. What are your sources of NTR? Got 3.5 performance of GOU warrants.
Our sources of NTR, Chair, includes we have a small private wing, which is 7 beds. We have a private outpatient.
Now, Kiruddu, I do operate a private wing. Anyway, you proceed. 7 beds, eh?
Yes, that speaks to the challenge of space that we have. We have other areas where the patients contribute a small fee, like endoscopy, X-ray, CT scan. So all these are areas where it is heavily subsidized, but we get a small fee. We also have dialysis, where patients who can afford can pay a small fee of 60,000. So all this contributes to our NTR. We also get some money on people who want to do work with us, especially research. They pay a small fee of about 100,000. So this also contributes to our NTR.
This is 972 million, close to $1 billion.
Yes.
What percentage of your budget is that?
This is our budget is 26, so one out of 30.
Accountant, do that mathematics. Your budget is 28 billion. Your NTR is close to $1 billion. You can say it is $1 billion. What percentage is that? Which percentage is that? The young brains.
About 3%.
About 3%.
Yeah.
Have we ever thought of having a free medical care to Ugandans? Have we ever thought about it? Because you have a budget of 28 billion. These collections of yours constitute 3%. Haven't we ever found challenges of where people fail even to pay the subsidized fee that you talk about? Don't we have instances where there are those who cannot afford it? Or they can afford?
The 97% is...
You are going to give us a structure of those charges,
Yes.
the fees that you do charge.
Okay.
Because, government has a commitment of providing that basic treatment.
Sure.
Except where under specialized circumstances, you can look at that.
Yeah.
But when you look at a 3% contribution, it's some money that can help in maintenance. But if real government planned well, it is some money that can also be avoidable to a taxpayer, because people pay taxes to get some of these services. For very specialized, you can say at least no. But there are those basics where people can get scans for free. So, honorable colleagues, we got utilization of GOU warrants.
But, Madam Chair,
Yes, Honorable.
Just on the observation you've made, I don't know whether the accounting officer has seen the direction you're taking, that the small charges, you've called them small, the 50,000, the 60,000. Do you have circumstances or situations where those who cannot afford those small monies get the services that you provide there for purposes of saving life?
Yes, Honorable Member. We have a waiver committee. One, these areas that I've talked about are just a small percentage of the patients that come to us. we have observed that the people who want to come and utilize our services, but they may not want to line up in the general queue. But the general wing is fully free. But if you want, as a member, let's say member of parliament, you want to come and see Dr. Seremba, and you don't want to get in the general queue, we have put a window where you can come and pay a small fee, and then you see Dr. Seremba here. If you feel like you have the time and you want to be in the general side, Dr. Seremba, the same Dr. Seremba will be available on a specific day on the general side. So that is one area that we look at. We look at the admission. Yes, we have a 7-bed inpatient for the hospital. But out of the 200 beds, only 7 are in the private. That means the 193 are all on the general side, and that is completely free. It's paid for by government. So, meaning that the majority of our patients are definitely benefiting from the government of Uganda funds that have been availed to us for a free of charge service. Even if a service is supposed to be paid for or contributed for, I want to give an example like dialysis. The cost of dialysis in the private sector, like I've mentioned before, is 400,000. Our patients in Kiruddu pay 60,000. But even that 60,000 that we tell them to contribute, about 80% of them can't afford it. But we don't deny them that service. We put them under the category that should be waived so that we provide the service. The same applies for other services. If you need a CT scan and you've had an accident and you can't afford it, we waive that. So there's a whole waiver committee, there's a process that handles all these patients so that patients are not denied this service.
But, yes, Honorable Mudimi.
Madam Chair, on the NTR.
First, let him finish on this thing of the waiver. You know, because you say at times 80% can't afford. It's what you've said.
Yes, in the dialysis.
That at times the dialysis 80% can't afford. If 80% can't afford, that means the majority can't what? Can't afford. For me, I think it would, our proposal would be how do we look out for having a free dialysis service? Because 60 is small, but you deny others a service. You know, there are areas where we spend extravagantly yet avoidable. These are the proposals you should bring. You know, so for now you can be lucky that you have the money, but there are those who are in dire need. They would like to pay, but they don't have. Those categories are there. So the things of waiver, you are promoting corruption for no good reason. If really government can afford to provide some of those free services, let it be. For those who want private, they look for the private because they want, you know, quick service, convenient, but government can afford to provide some of these services for free. Let's look out for a medical care service that can afford to serve the community, the wananchi. The reason as to why government came in for provision of basic health care is because, I mean, we are entitled. It's a constitutional mandate on the side of government to provide free medical, these free services, mandatory. So where for very, very specialized, we can say, no. But for these others where we can afford, let's reduce on the inefficiencies and serve the people better. Yes, Honorable.
Thank you very much, Chair. Chair, I wanted to follow up on the issue of the waiver committee. How effective is it? How soon does it act? You said, for example, if you want to do